everyone. I'm Dr. Judy Ho, and welcome to Mental Health Bites. In this podcast, we'll cover timely mental health topics, answer one of your burning questions, and leave you with a quick, actionable tip to improve your mental wellness every single day. Let's dive right in to the timely topic of today. Today, we're diving into the world of alternative treatments for depression and anxiety. So, this seems to be all the rage these days. It's what everyone's talking about. People who feel like they might be treatment resistant, their depression, their anxiety symptoms are not improving, and they're looking for other resources to feel better that are not in the realms of traditional psychotherapy or psychotropic medication. So, for many people, they'll say that traditional treatments like cognitive behavioral therapy or SSRIs, which are the first line prescribed antidepressants and also anti anxiety medications, have been helpful, but not really for really eradicating their symptoms. And also, sometimes there are treatment resistant individuals who have tried multiple treatments and things just don't seem to be working for them. And research shows that it could be up to 20 to 30% of individuals. And that's where alternatives like ketamine therapy, transcranial magnetic stimulation or TMS, and electroconvulsive therapy, ECT, and other emerging therapies come in. So, right now, we're going to explore some of the pros, cons, and controversies and who these treatments might be right for. Later in the podcast, I'll answer a listener's question about choosing the right treatment and provider, and then we'll wrap up with a practical daily tip for boosting and regulating your mood. So let's get started. First, let's talk about ketamine treatment. This has been getting a ton of media coverage lately. And somewhat related to this is the fact that Matthew Perry, beloved actor and one of my favorite actors from the show Friends, was found to have died via a ketamine overdose. And it appears that there were multiple individuals involved in this. He was seeking this ketamine through a lot of different sources, and there were some not so scrupulous doctors, to say the least, who were providing it to him at super high cost because essentially they are allegedly taking advantage of his long-time addiction issues. And people are talking about, well, is ketamine really safe? And given this and the fact that there are addictive qualities, should it even be given as an alternative treatment, especially if the patient has a history of addiction issues, which makes it more likely that they might be addicted to ketamine treatment? So, ketamine treatment was originally developed as an anesthetic, and it's recently been used in an off label way, repurposed for depression treatment, particularly for those who haven't responded well to other medications. So, when we say that it's being repurposed or it's an off label use, it means that it's not FDA approved officially. And some providers just don't feel comfortable prescribing it at all. Other providers have essentially made a whole practice out of it. So, what are the pros? Well, one of the biggest advantages is ketamine's rapid onset. Unlike traditional antidepressants that can take weeks to show effects, ketamine can start working within hours. It's been especially promising for some forms of treatment resistant depression, offering some relief when other options have failed. Ketamine infusions, when given in low doses, monitored by a doctor, have shown some results for people in many cases. But there's some cons. As I mentioned earlier, ketamine has the potential for abuse given its history as a recreational drug. There's also side effects like dissociation, dizziness, increased blood pressure, and also the long-term effects are just not fully understood. If somebody has a certain predisposition towards psychotic illnesses or symptoms, ketamine might actually exacerbate that or elicit a form of psychosis or an actual psychotic episode. And of course, that's very, very scary. And oftentimes, individuals will have to be hospitalized if the psychotic symptoms are very severe. So, the controversy stemmed from this debate over whether or not people should even be using them due to the side effects, concerns about how accessible it is, because as I just mentioned, there is a black market for it from doctors. That's what happened to Matthew Perry. And the ethical considerations if it's off label use, if it's not FDA approved, how do we know that it's truly safe? And also, because it's not FDA approved, what is really a safe dose? There's so much that we don't know about ketamine treatment. And let's move on now to transcranial magnetic stimulation, or TMS. This is a relatively new treatment for treatment resistant depression. And the pros is that it's non invasive with minimal side effects. So it's done in an outpatient setting, and individuals will do TMS treatment sometimes for several sessions over several weeks. So they'll go into a clinic and on an outpatient basis receive TMS maybe 3 or 4 times a week, up to 6 to 8 weeks. That might be an initial course. And TMS actually has proven efficacy for those with treatment resistant depression. You don't need anesthesia, and you can return to your normal activities right after a session. So, TMS is a procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of depression. And the reason why it's called non invasive is because it's done without using surgery or cutting the skin. And by the way, it is approved by the FDA. But TMS is only used generally when other depression treatments haven't been effective. And this brings me to one of the controversies of both TMS as well as ketamine, is that even though they're more supposed to be utilized in last resort type situations, some people are jumping right into these treatments rather than actually trying the evidence based approaches that are more traditional, like cognitive behavioral therapy and antidepressant medications like SSRIs. So, the controversies around TMS largely focus on accessibility and cost. It's pretty hard to find a really good TMS clinic. And also, there's debates on its efficacy compared to what other treatments might be. So, again, if you're jumping to this instead of trying some of the other traditional therapies that are efficacious, that's a potential part of the controversy. But it's generally considered a safe and effective option for many. So, it might be something helpful to talk to your doctors about. Now let's talk about electroconvulsive therapy, or ECT. So this is something that you may have heard of, and ECT actually dates back many, many years. It was one of the first treatments for severe depression. And oftentimes, when people do not respond to any other treatments, ECT is a form of a last result. It's brief electrical stimulation of the brain while the patient is under anesthesia, and is typically administered by a team of trained medical professionals that usually include a psychiatrist, an anesthesiologist, and a nurse or physician assistant. So, ECT's effectiveness in treating severe mental illnesses is recognized by the American Psychiatric Association, the American Medical Association, the National Institute of Mental Health, and many, many other similar organizations in other countries. It's really effective for the treatment of episodes of serious mental illness, but it doesn't prevent a return of the illness in the future. So, that can be some of the cons. Also, some other cons are the potential for memory loss, both short term and sometimes, unfortunately, long term. And because ECT requires general anesthesia, there's still a stigma attached to that. And also, we remember some of those old movies where people were being shocked, and we called it electroshock therapy. It's much safer now, and they've really honed down on the procedure. But that just scares people when you're thinking about these old movies where people were shaking while they were under ECT, or the older version of it. But it is efficacious, and those are some of the pros. And it's especially helpful for severe depression and often works very quickly, which is crucial in emergency situations. So, controversies, there's ethical considerations, particularly around consent. When somebody's depression is so severe, if they're also having other symptoms like psychosis, are they actually able to truly make a decision about whether or not they even want to undergo ECT? So, that's a major controversy. And briefly, there are some other emerging treatments on the horizon that I just want to quickly mention. Other psychedelic assisted therapies using substances like psilocybin or MDMA have actually been talked about and are starting to take more attention in the research world. So maybe we'll learn more about those in these future years. These treatments are definitely in the experimental stages and come with their own sets of pros and cons. Maybe they do help for some individuals and even help them to achieve insights. But of course, concerns about safety, legal status, and long term effects are there. And I think that one of the things that we're seeing is that people oftentimes think that they can just start doing some of this at home. It's kind of like a DIY approach to treating depression by utilizing psilocybin or MDMA and what they believe is microdosing or therapeutic doses. And I absolutely advise against that. Please do talk to your doctors. And if you are interested in alternative treatments, hopefully you can have an honest conversation with your doctors. And there are non judgmental doctors who will entertain this discussion and actually tell you about the pros and cons, as I've tried to introduce in this podcast. Now, let's move on to our listener question for today. So, Nancy asks, how do I know if an alternative treatment is right for me? What should I consider before deciding? And how do I find the right provider? That is such a great question, Nancy. I'm so glad that you asked this. So, first, I want you to reflect on your current treatment history. Why are you considering the alternative? Are your symptoms severe or life threatening? Have you just not gotten any real treatment response from the more traditional treatments that I mentioned earlier in this podcast? And how comfortable are you with the potential side effects of these newer treatments that don't necessarily have as much research behind them? I also want you to consider practical factors like your history with other treatments and side effects of those, personal preferences for non invasive options, as well as the cost and availability of these potential alternative treatments in your area. It's also really important to consult a qualified mental health professional who understands these treatments well. I think it's so important that you interview your providers, really ask them about their experience in administering these alternative treatments, what they know about it, how many patients they've treated, what the outcomes are. If you have any doubt, do not start treatment with the provider because unfortunately, with these alternate treatments, there are some amazing providers that operate them, but there are also some that are just kind of trying to take advantage of the hype and really they don't know what they're doing. And I don't want you to go to one of those providers. So definitely make sure that they have the proper experience, the proper credentials. Look for board certified providers that are specialty experts in their area. And I always encourage people to check on the licenses of their providers. A lot of people don't do that, but sometimes they might have disciplinary actions against them for other problems that they've had with other patients or administering certain treatments. So definitely make sure that you just do all your homework before you commit to trying this new type of therapy. I hope that helps, Nancy, and good luck. Let's move on to our practical tip of the day. So, today's mood boosting tip that you can do without any side effects and without any controversy is mood boosting with morning light exposure. This is all about harnessing the natural power of morning light to boost your mood and energy levels throughout your day. So, why does morning light exposure work? Well, it's all about your body's internal clock, known as the circadian rhythm. This internal clock regulates a wide range of biological processes, including your sleep wake cycle, hormone release, and even your mood. Morning sunlight is rich in blue light, and blue light is especially effective at signaling to your brain that it's time to wake up and be alert. This helps regulate the production of melatonin, the sleep hormone, so that you can feel more awake during the day and sleepier at night. By getting natural light exposure in the morning, you're essentially setting your body's clock, making it easier to fall asleep at night and get good quality sleep and feel more energized and positive during the day. Several studies have shown that consistent exposure to morning light can reduce symptoms of depression, especially in people with seasonal affective disorder, and improve overall mood and well being. So here's how to incorporate morning light exposure into your daily routine. What you're going to do is to try to step outside first thing in the morning, maybe within the first hour that you wake up. And all you have to do is to step outside or sit near a windowsill where the light is able to come through the window for about 10 to 15 minutes. And this is important because if you don't do it in this early morning time and you try to do it maybe late morning or mid morning, it's actually going to mess with your circadian rhythm. So make sure that you try to schedule this for the first hour within waking. So this is very simple. It could be walking your dog, taking a quick walk around the block, enjoying your morning coffee by the windowsill or on your porch, or maybe doing a quick stretch routine in your backyard or at a nearby park. And another important piece of this is to combine light with movement. So it's even better if you can combine this light exposure with some gentle exercise or stretching. You don't have to do a full blown exercise routine, but a little light yoga in the garden, that can really enhance the benefits and boost your endorphins even more and get your blood flowing. I also would love to see you make this a ritual. You could designate a specific time each morning to sit by the window or go outside, set an alarm on your clock for this, or listen to your favorite podcast. Interestingly, this podcast is less than 15 minutes each time. So maybe you can listen to this podcast while you're doing your morning sun ritual. You can also do a guided meditation. You can see a lot of free ones available on YouTube and other resources. You can do a quick journaling, maybe read something inspirational to you, but creating a consistent routine around this practice and maybe adding other mindfulness practices, like I just suggested, can make this a more sustainable habit. Also, if you can't get outside, try to spend time by a window that gets plenty of morning light. That might be the most practical thing to do as the weather gets colder. So just open the blinds as soon as you wake up and then consider moving your morning activities like reading, making your to do list, or eating breakfast to a bright spot in your home. Even indirect natural light can help, even though that direct exposure I just explained is a little bit more effective. And if there are cloudy days, rainy days, of course, as we're coming into the winter months, that's going to be more common in certain areas. Use a light therapy box. So during the darker months, or if you live in a place with limited sunlight, try the light therapy box. You can buy these online for as cheap as $50 or less. These devices mimic natural daylight and can be particularly helpful as well when you can't get access to real sunlight in the morning. And the best thing is they're really portable. They're small and you can put them in your bag and can utilize it everywhere, even when you're traveling. So, integrating morning light exposure into your daily routine is a very simple and natural way to support your mental health. I'd really love to see you use this powerful tool, and I want to hear how it's working for you. Thanks, everyone, for tuning into this episode of Mental Health Bites with me. If you've enjoyed this video and found it helpful, there's plenty more where that came from. Make sure to hit that subscribe button and click the bell icon so you never miss an update. Give this video a thumbs up if you liked it and leave a comment below with your thoughts or any questions you have. Also, feel free to share this video with your friends and family who might find it useful. Stay tuned for more great content, and as always, thanks so much for your support.